This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
I was diagnosed with endometrioid carcinoma early this year. I was diagnosed with breast cancer stage 2 at the age of 48.
I was diagnosed when I was 11 with ovarian cancer.
I was 50 when I was first diagnosed with breast cancer, stage 3C.
And I'm fighting for it. And I'm still fighting for it.
And I survived it.
I survived cancer.
Cancer is the most life-threatening disease all over the world. According to the Philippine Cancer Society, 8 Filipinos die of cancer every hour. 200 deaths each day, or a total of 70,000 lives are lost to cancer every year. In women, there are 6,000 cases of cervical cancer diagnosed each year. In 2010, there were 2,165 new cases of ovarian cancer and 1,760 cases recorded for uterine cancer. According to studies, breast cancer is the leading cancer that hits women in the Philippines. In Asia, the Philippines has the highest number of reported cases of breast cancer. With the prevalence of breast cancer in the country, the Philippine Breast Cancer Foundation was born.
We make sure na meron silang makukuhang sponsors for their chemotherapies. We go to communities, we partner with other organizations to increase awareness on breast cancer and breast health.
Tonight, we will talk about breast cancer and other cancers that affect women. Can cancer in women be prevented? How important is early detection in these cases? And are there medical breakthroughs to combat these kinds of cancer? All these and more on MedTalk.
We're still celebrating Women's Month here on MedTalk. Last week, we discussed an integral factor in a woman's body, the menstrual cycle. Tonight, we will talk about cancers that target women. Joining us is Dr. J. Famador, a gynecologic oncologist from the St. Luke's Medical Center, Makati Medical Center, and the UERM Medical Center. Also joining us is Dr. Therese Narcisa Fajardo, medical oncologist from the St. Luke's Medical Center and the Makati Doctors Hospital. You can participate in the discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, doctors. Welcome to the show.
Good evening.
Good evening.
As mentioned, it's still Women's Month, and we can't let this month go by without talking about the cancers that affect women. But before that, we'd like to understand what is cancer and how does this develop?
Therese?
Yes. Good evening, everyone. I'd like to correct, I'm from St. Luke's Medical Center and Manila Doctors Hospital for all those colleagues that are watching now. So cancer, briefly, is a malignant tumor. Oh, what is a tumor? It's a abnormal and functionless tissue. So what makes it malignant? Malignant means it's not benign. So malignant means that it has the ability to invade other tissues or spread outside the confines of its original tissue.
To add to that, basically the whole system, there's a regulatory system which is there with us. Our body is composed of cells which continually divide, produce, and we shed off old cells, we create new cells. And when there's a breakdown in that regulatory system, for example, we start producing and keep producing new cells, and these cells don't die off naturally. That's when you start to develop a tumor, something that just constantly grows, and tends to spread. And that's what we call cancer, basically. So, and there are various reasons to why this happens, no? It can be started off by a viral infection, Sometimes it's hereditary, it's genetic, something passed on. And sometimes just exposure to different things, food, chemicals.
Wow.
Yeah.
So many different factors and so many things to consider. Now let's go into the main topic of tonight's episode. We're talking about the different types of cancers in women. Let's first talk about breast cancer.
Yeah.
So what happens to a woman's body when she is detected with breast cancer?
Well, it usually presents with this abnormal lump in the breast or abnormal changes, skin changes or nipple changes. And this cancer in the breast that is detected has, depending on the stage that it is diagnosed, it has the ability to spread to other tissues. So that's what happens to the woman. It has the ability to spread outside the breast, to the lungs, liver, bone, and brain. But if detected early, it is not really that scary, as we say, you know, just the term cancer. It can be cured. So.
And you mentioned early detection is key. So
That's right.
how do we examine our breasts properly? How do we detect if there's something wrong or there's something amiss with our system for that day?
Well, good you asked that question, because starting at the age of 20, it is recommended that a woman is taught how to do a self-breast examination. Every month, you do it 1 week after the first day of menses, because it's less painful. It's easier to examine your breast at that part of the menstrual cycle. And then there are, you know, several steps in doing the breast exam. I don't know if you want me to go over it.
Yes,
or...
sure, yes, please.
Okay. So when you see your doctor, the doctor can easily explain to you how to do it. But first, you stand naked in front of the mirror and then observe your breast, the symmetry, if there's a nipple discharge, skin discoloration. You examine it with your arms above your head, and then also doing this on your hips, you know, holding your hips to see if a mass pops out from the breast, actually, that it tightens the muscles. Then usually you do it while lying down with one of your arm underneath your head and with a pillow underneath, okay? And then so you palpate your right breast with your left hand and palpate your left breast with your right hand.
Doc,
So-
we have a video of that a little later on so that
Okay.
our viewers can understand it a lot better. But thank you very
Yes,
much
yes,
for
that's
explaining
better.
it. That's like
better.
a teaser into the video
Okay,
later
that's better,
on.
yes.
So we talked a little bit about breast cancer. We'll go back to that later. How about ovarian cancer? How does this develop in a woman's body? And is there a particular area for the ovarian, for the cancer to develop?
As to how it develops, no, at this level of our understanding, science, medical, we still don't know really what causes ovarian cancer. Most of it is really spontaneous. There's a small minority, of a small percent, which is really genetic, no? But it's really small. Most of it is spontaneous. The difficult thing about ovarian cancer, it's the most difficult to detect early. Sometimes it's really, because it's inside.
Yes.
Sometimes a patient will start feeling heaviness or pain, and usually when they have symptoms, it's already late because it's a mass already growing. The strategy is really to detect it while it's really early. But for ovarian, for some reason, we haven't yet developed the tests that can really detect it early. Most often, when we diagnose an ovarian cancer early, it's parang chamba lang. No? A patient gets operated on for something else, for a myoma, something benign, and then whoa, they see an ovarian cyst, they have it biopsied, it turns out to be cancer. But most often than not, we tend to diagnose ovarian cancer a little bit late.
So you mentioned that if there's pain, one should visit their
Once they feel
gynecologist already.
something enlarging, you know, sometimes they think na, you know, I'm just getting fat. You
Yes,
know.
or maybe I'm bloated,
Yeah,
or maybe
bloated.
natamaan lang
Yeah.
or something. But,
So that's why it's very important for women to have that regular checkup, you know, at least once a year with their gynecologist. That's the benefit of that.
Okay. And you mentioned we have regular visitors on our Facebook page, and one of them is Mary Joyce de Guzman. She asks, doctors, does obesity increase the risk for uterine cancer?
Yes. Uterine cancer, basically most uterine cancers, more specifically endometrial cancer, is caused by high levels of estrogen. Estrogen is primarily in a woman produced by her ovaries.
Yes.
But another source of estrogen is adipose tissue. So you have excess fat, you're obese, you definitely will have excess estrogen in your body. So you'll notice most obese women will have irregular menstruations because the hormones are imbalanced. And the prolonged exposure to estrogen can put you at risk of developing endometrial or uterine cancer.
Wow, so they must watch their health talaga,
Yes,
no?
that's what we always stress, no?
Yes.
Yeah.
Thank you for that, doctor. A Twitter question from Carla Enriquez. I had breast enhancement. Would I be more prone to breast cancer? Dr. Fardo?
Yes, that's a very interesting question. There have been controversial studies that associated breast enhancement or implants, silicone or saline, to another type of cancer in the US. It was lymphoma, actually a rare cancer of the breast. But after further studies, they haven't really found an association between this saline silicone implants and breast augmentation to breast cancer. So it's not directly, the direct association is not strong. There is no strong evidence for that. I have to say though that if you do have an implant, it makes it harder to detect the early lesions. That is the important case to be made, but not to change people from doing breast augmentation for that reason. But you just have to be aware of that, and maybe you need more sophisticated tests to detect it. Like instead of a mammogram and ultrasound, you will need a breast MRI to accurately detect lesions if you have breast augmentation. So that would be the only case there.
Is it done more often than those who did not have any breast implants?
The breast MRI?
Yes.
The breast MRI is done for that, but there's a limiting factor. The cost is higher. It's also done for those with dense breasts who have strong family history of breast cancers. So you would like to detect them earlier. It's more accurate. Yes, so we do it for those two reasons, those with high risk and
those who have
breast augmentation.
Well, thank you very much for that, doctors. Another question from our Twitter account. Danica Rivera asks, can cancer be sexually transmitted? Dr. J?
Yes, specifically cervical cancer. Cervical cancer is really acquired through sexual intercourse. Cervical cancer is caused by a virus. It's called the human papilloma virus. It's the same virus that typically causes warts. So it's transmitted by skin-to-skin contact. The cervix is an organ in the vagina, which is also composed of skin tissue. And the only way for the virus to get in touch with that cervix is through sexual intercourse. And that's primarily the reason why it can be transmitted.
Spread, no?
So in answer to that question, yes. For cervical cancer, you have to be very specific. Not all cancers.
So how do we avoid getting cervical cancer?
Well, of course, sexual intercourse is a natural activity. Just like going out where there are public places where you can also be exposed to people with colds and cough, and you get it, no?
Yes.
The same way, a woman will definitely be exposed to this virus. The best way to prevent cervical cancer is to have a regular pap smear.
How often should one get
It used to be recommended to have it once a year, but recently studies have shown that having it every 3 years is as good as having it every year. The important thing is the regularity, having it every year. It's not a one-time, big-time test. No? You have to have it regularly. The reason the pap smear is very effective in preventing cancer is its ability to detect a pre-malignant lesion. It can detect changes before they become cancer, and it allows us to intervene early. So we can reverse the process. Before it even develops to cancer, we can already reverse the process.
Again, early detection really is key. We'll be talking more about the different cancers that affect women when MedTalk returns.
According to the World Cancer Research Fund, broccoli, berries, and garlic are food with the strongest link to cancer prevention. These are low in calories, has lots of phytochemicals and antioxidants.
We're back here on MedTalk and still discussing cancers that affect women. We have a question on our Facebook page, doctors, from Marilyn Samonte. When is the best time to do a breast self-examination? BSE. You were talking about this earlier, doctor.
Yes. So the best time is wait for 7 days from the first day of your menstrual period. Because if you do it before your menstrual period, it's going to be painful. The lobules of your breast will be engorged, and you will not be able to do an effective breast examination. So wait for 7 days.
7 days. Okay. Another question, thank you, doctor. Another question from Jeneline Santa Cruz. If I'm not sure with my breast self-examination, should I undergo a mammography right away? Let's check this. So, doc, if she's not sure about her examination, should she undergo a mammography right away?
Not right away. I think most important is first, go to the doctor. Any doctor will be able to tell you how to do the self-breast examination. Go to the doctor and let the doctor teach you how to do the self-breast exam. Actually, aside from the monthly self-breast exam, you have to do yearly visits with the doctor doing the breast exam himself or herself.
Okay.
I don't know if we should.
Yes,
I guess we should.
Fix this a bit and then just show them.
Should I show them?
Yes, please.
So ideally, right, briefly, you could do it lying down, but some women find it easier to do while in the shower when their hands are slippery. So the three middle fingers on the breast, you should cover the whole part of the breast. So there are two techniques, okay? You can start from the nipple, this is the nipple, the areola, smaller circles, making bigger circles. You should really be able to palpate it like that. All right, Okay, so that way, so just for the interest of time, cover the area, but you really have to feel deep, very deep. Okay, feel for any masses, okay, pain, whatever.
So those are the 5 P's of breast examination. We have
yes,
position, palpitation, pressure, perimeter, and pattern.
Yes, so that's one style or pattern, but the other one is, going in and out vertically. Make sure you cover, with the same pressure, cover all parts of the breast. And not only the breast, I have to emphasize, it's also important to cover the axillary or armpit area, because this is where the lymph nodes are. This is where the lymph nodes that are draining the breast are, and it's very important for you to feel that on both breasts. And underneath the clavicle and over, there are lymph nodes here that you need to palpate. Also the center of the chest. So you do that, left breast, palpate with your right 3 middle fingers, and of course the right breast, you do it with your left 3 middle fingers.
Well, thank you for that, doctor, because others might think that this is the only area that they have to cover,
That's
but
right,
they have to go up and they have to go under
That's
as well.
important.
And to add,
Yes.
the more often you do it, the more you are familiar with what the normal feels like. Then suddenly, if you feel something that you never felt before, that's when you try and see the doctor na.
Yes.
That's the whole purpose. So the more often you do it, you're used to it, you know how it feels, this is normal, then one day you feel something. I usually tell my patients, what you're looking for is something that feels like a marble, something
It's
hard.
hard
yeah.
already. Okay.
Yeah.
So let's not wait for
Yeah.
that marble to come out. You know, we should always be mindful. It's our body. We should take care of it. We should understand it and know if there's something amiss. That's right. A Twitter question from Glyza Naik. How often should I get a pap test? Well,
Yeah, we answered that a while
we
ago,
answered it a
We
while
used
ago.
to, most of us still do it annually. That's how we got used to, that's our training. But the most recent recommendation is to do it every 3 years. And when do you start? 21 years of age.
Okay.
Every 3 years.
All right. How about the pelvic
The
exam?
pelvic examination,
Yes.
yeah. Well, the pap smear is to help us detect cervical cancer. Okay, the pelvic exam will help us detect any masses in the ovaries or in the uterus. So it's recommended to have your gynecologic oncologist or your gynecologist examine you once a year.
Okay.
Once a year, yeah.
I asked that because we do our breast examination, we have a pap smear. And in that area, the pelvis also.
Because that area is quite
Yes.
difficult for you to do your own examination,
exactly,
right? So
yes.
you really need your OBGYN to help you with that. You should see him or her once a year.
And they say during exams like this, radiation comes into play. Is it a factor in bringing about certain cancers also when one undergoes like an X-ray or a mammogram?
No, those are low-dose radiation. There is a risk for high-dose radiation if they've had, like, as a child, treatment for lymphoma with high-dose radiation, or survivors of nuclear bomb, accidental exposure, but not from the routine mammogram or chest X-ray tests. You don't really get breast cancer from that low dose for radiation.
Just curious, do men also get breast cancer?
Yes.
Yes.
Yeah.
Yes.
Okay, I just thought about it because
Rarely.
But
Yeah.
it's, I'm asking that also because the Philippines is the #1 in Asia for breast cancer. Why is this so?
I think it's it could be both good or bad. Either people are going to their doctors and having themselves examined or subjected to screening tests. That's why these breast cancer are diagnosed. Also, but the bad side is maybe there are risk factors like our lifestyle, because you mentioned obesity.
Yes.
Obesity is also a risk factor for breast cancer because the fat cells can convert into the estrogen, the hormone that is a nutrient for the cancer cells. Other is, alcoholism.
Smoking? Does smoking contribute to breast cancer?
For a lot of cancers.
In general.
In general.
Okay.
It's an enemy of
Yes.
enemy of the doctor. Really, is smoking. It doesn't really do anything good, but except causes cancer, a lot of diseases. Late menopause, early menarche, and late age of first pregnancy. So as women are more into their careers, having a family is pushed later on. So this is part of the lifestyle, like having your first pregnancy, full-term completed pregnancy at 30 and above is considered a risk factor.
Okay. We talk about risk factors about women 30 and above. For ovarian cancer, is that a risk factor for women 30 and above, or those who have unexplained infertility maybe, or those who are
We're talking about age and ovarian cancer. Majority of cases are seen at the age of 50 to 60. So premenopausal and menopausal. But there are also certain ovarian cancers that have a predilection for younger
ones.
Yeah.
Why is
Adolescents. When you talk of ovarian cancer, it's a variety of types, no? And then there are those that are commonly really seen in children and in adolescents. The most common are seen really in older women. Yeah, why?
Yes.
It's difficult to answer.
Okay.
Even that question, we still do not. But we know it does happen. We know the numbers. We know the incidences. That what really causes it.
Still don't know why.
Yeah.
But I know why our viewers tune into MedTalk, because they want to ask questions from our doctors. A Twitter question from April Joy Tolentino. What screening tests are available for uterine cancer?
Okay.
Dr. Famador.
For uterine cancer and ovarian cancer, we still do not have any screening
tests.
test. Yeah. Only cervical cancer. In fact, cervical cancer is a prototype of a cancer that has a very effective screening test. As I said a while ago, it can detect the pre-malignant phase. No?
Yes.
In breast, for example, we have the mammography as a screening test.
Yes.
But at best, it can detect it early. It's already cancer, but early detection. For cervical cancer, we have the pap smear, which can detect it even before it's cancer. For uterine, we don't have a test yet. The best is symptomatic. See your doctor right away once you have any abnormal bleeding.
Okay.
Yeah, so it has to be investigated. For ovarian, again, it's also symptoms. Right? Any symptoms that are bothering you in the pelvic area, bloatedness, enlargement, you feel a mass, immediately see your OBGYN.
Okay, so you can be the doctor for yourself in that particular case. I mean, just to monitor what's going on inside your body, and then get in touch with your particular doctor. Because as you said, there are no screening tests set for that. Maybe in the future they will come.
Yeah,
up with something.
for example, for ovarian, we've been looking into the combination of ultrasound and a tumor marker test, a blood test. No, it had much potential, but the studies have shown that they're not that effective or cost effective. No, so far wala pa.
Wala pa, okay. But so far we've discussed about breast cancer. We've talked about the exam. We've talked about the possible factors, lifestyle, environment. Now let's talk about when one is detected, or when one has been detected with breast cancer, there are choices. And depending on the stage, I understand there's a lumpectomy and a mastectomy. Please tell us the difference between the two.
Okay, for early stage breast cancer that can be taken out with surgery, you have two choices, modified radical mastectomy or lumpectomy with radiation. Most of my patients actually opt for the modified radical mastectomy, wherein they take out the whole breast, including the lymph node tissues. When on my breast exam, I pointed to you out the lymph nodes where the breast drains. So they take that out too. For the lumpectomy with radiation, that is actually called breast conservation surgery, when they want to maintain their much of their breast. So it's just a partial breast resection. They take out part of the breast with surrounding normal tissue, but they have to undergo radiation after that if they do just lumpectomy, if they don't have mastectomy, which is the whole breast. For those who are really interested in maintaining, a good aesthetic, a good breast asymmetry, what they do is actually with the mastectomy, you can do immediate reconstruction on the same surgery, and we can do that now. With a lot of patients starting to choose that here, even in the Philippines. So they will not be, depressed when they see their breast gone. That's very important in the healing of the patients. Is they like what they see after. That's part of the healing after breast surgery. That's for the early. As we go on late stages, that is when you will need the systemic treatments, chemotherapy. There are oral treatments also, chemotherapy, targeted therapy, and hormonal therapy. So these are several armaments as doctors we have in the fight for breast cancer, and they are quite effective. I am fortunate to tell you that they are really quite good, especially now if patients come to us and seek these treatments.
You mentioned the healing process, not only physically but also emotionally.
It is important
for the patient. It is very important, and it is important that we have knowledge about these different types of cancers that affect women, the signs and symptoms. Again, early detection is always key. Any parting words, last message, or tips to our viewers?
Maybe what we want to impress upon our viewers, there's this fear talaga of cancer, no? So sometimes they will not go to the doctor just out of fear or seek treatment, no? Well, what we have to tell them is that, one, it can be prevented. Some cancers really can be prevented. The one is cervical cancer. Now, if they are diagnosed, they can be treated. No, cancer is a disease, it's really nakakatakot, no, but it can be cured, as Dr. has said. So once they know it can be cured, we have the way to treat it. I mean, that would encourage them to come and do it. The delay is what is sometimes the problem. They know there's something wrong, or the doctor has told them you have this problem, it has to be treated this way, but they tend to, delay just out of fear, no? Because they're afraid of chemotherapy, makakalbo ako and everything, mga ganun. But, kaya. It can be treated, you can go through it, you just have to do it, and you'll turn out okay.
Thank you very much, Dr. Famador.
Yes, that's right.
Dr. Fajardo.
Yes, so early detection is key, and always take care of your health, because if you are diagnosed with cancer and you are healthy, yes, I mean, good weight, good lifestyle, eating habits, no smoking, moderate to minor alcohol consumption. If you are unfortunately diagnosed with cancer, you can beat this disease with the help of the doctor. And it's always important that when patients are diagnosed with cancer, that's why I say about the overall emotional, support. It's very important, ask people for help when you're diagnosed with this, ask a lot of questions.
Okay, thank you very much. Thank you very much, doctors. Thank you so much, Dr. J. Famador and Dr. Therese Narcisa Fajardo, for helping us understand tonight's topic. See you again next Tuesday on MedTalk as we talk about the reproductive infections that women usually get. 10 p.m. on your scheduled on-air consultation here on the Solar News Channel. This is Angel Jacob. Thank you and good night. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Angel Jacob and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
I was diagnosed with endometrioid carcinoma early this year. I was diagnosed with breast cancer stage 2 at the age of 48.
I was diagnosed when I was 11 with ovarian cancer.
I was 50 when I was first diagnosed with breast cancer, stage 3C.
And I'm fighting for it. And I'm still fighting for it.
And I survived it.
I survived cancer.
Cancer is the most life-threatening disease all over the world. According to the Philippine Cancer Society, 8 Filipinos die of cancer every hour. 200 deaths each day, or a total of 70,000 lives are lost to cancer every year. In women, there are 6,000 cases of cervical cancer diagnosed each year.
Doctors, welcome to the show.
Good evening.
Good evening.
As mentioned, it's still Women's Month and we can't let this month go by without talking about the cancers that affect women. But before that, we'd like to understand what is cancer and how does this develop?
Therese?
Yes. Good evening, everyone. I'd like to correct, I'm from St. Luke's Medical Center and Manila Doctors Hospital for all those colleagues that are watching now. So cancer, briefly, is a malignant tumor. Oh, what is a tumor? It's a abnormal and functionless tissue. So what makes it malignant? Malignant means it's not benign, so malignant means that it has the ability to invade other tissues or spread outside the confines of its original tissue.
To add to that, basically the whole system, there's a regulatory system which is there.
Protection in these cases? And are there medical breakthroughs to combat these kinds of cancer? All these and more on MedTalk.
We're still celebrating Women's Month here on MedTalk. Last week, we discussed an integral factor in a woman's body, the menstrual cycle. Tonight, we will talk about cancers that target women. Joining us is Dr. Jay Famador, a gynecologic oncologist from the St. Luke's Medical Center, Makati Medical Center, and the UERM Medical Center. Also joining us is Dr. Therese Narcisa Fajardo, medical oncologist from the St. Luke's Medical Center and the Makati Doctors Hospital. You can participate in the discussion by calling our hotline. You can also follow us on Twitter, post on our Facebook page, or send us an email. Good evening, Dr.
2010, there were 2,165 new cases of ovarian cancer and 1,760 cases recorded for uterine cancer. According to studies, breast cancer is the leading cancer that hits women in the Philippines. In Asia, the Philippines has the highest number of reported cases of breast cancer. With the prevalence of breast cancer in the country, the Philippine Breast Cancer Foundation was born.
We make sure na meron silang makukuhang sponsors for their chemotherapies. We go to communities, we partner with other organizations to increase awareness on breast cancer and breast health.
Tonight, we will talk about breast cancer and other cancers that affect women. Can cancer in women be prevented? How important is early detection?